Okay. I'd like to call the special meeting of September 16th to order. It is 6:31 p.m. If we could all please rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands,
one nation,
under God, indivisible, with liberty and justice for all. Good evening, everybody. Are there any additions or changes to the agenda?
Yes, Michelle. I'd like to request that the wording for the recommended action in 2.2 be changed from motion to consider the adoption of the resolution for athletics to return to play and follow the protocols set in place by the district as recommended by Section 3, Athletic Director and Superintendent. And I ask that we insert for the fall athletic season. So it would read, motion to consider the adoption of the resolution for athletics to return to play for the fall athletic season, and then continue on as normal. I think the way it's worded could be taken in different ways.
The motion was brought to us by somebody. Debbie, help me. Sorry. So we can make this change, but we shouldn't be adjusting too much more of the content of it. So I think what you're suggesting, Travis, is fine. If everybody else is fine with that change.
It was brought to us from the labor relations attorneys.
That's where it was. Thank you.
If you guys don't want to change it, I get it. I just think that we should insert for the fall athletic season. I don't know if that really...
Is everybody okay with that? Obviously, we'll have to do... Okay. And then my only question is, are we doing the community comments prior to or after the athletic discussion?
It seems to me that if there's going to be a vote somewhere, if we're going to do community comments, they should be before.
Right, but do we want the discussion, community comments, and then the motion?
Yeah. Can we start out with community comments before?
I think I'd like to hear community comments first.
First? Okay, so we'll leave that there. So we only have one change to the agenda. Can I have a motion to accept the amended agenda, please?
I'll move.
I'll second.
All those in favor?
Aye.
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 Aye. All right. So we do have a handful of people watching us. I'm going to post there. Sorry, I didn't do this yet. So right now we're at 2.1, which is community comments, and we'll see if there are any here. Bill, your thought on bringing our professionals into this part of the comment, or are we bringing them in during the discussion period?
I think we should start with our professionals at this time.
Okay. So while we wait for some comments to come in online, if you guys don't mind, I'll just kind of go around the circle. I thank you all for coming here with your professional knowledge on COVID and the subject of what we're working on tonight with athletics. I thank you for bringing your professional opinions to our board meeting so that we have those. If you don't mind, I'll start just by going around. Jeff, would you mind starting and letting us know a little bit about your professional background for the reason why we invited you, and then go from there?
Sure. So my name is Jeff Holm. I am an associate professor of biology at Colgate University. My training is as a virologist, and I have been co-chair of the task force on reopening Colgate. And so I've been thinking a lot over the last several months about how to reopen things in a safe manner. And so that experience is, I think, why I was asked to speak tonight. I want to start by commending Ms. Reynolds for the plan of returning. I think that there is a lot of really good, solid preparation that is there that is likely to be effective. I guess my concern is really not so much with Hamilton Central's response, but just with especially the classification of soccer as a low to moderate risk sport. And that's really the where my concerns mainly lie. So as someone that teaches epidemiology and infectious disease, and has been thinking about Madison County and the Department of Health for a while, the thing that really has me concerned is what's called close contact. And that is people that come into contact with someone that is infected with SARS coronavirus. And as a result, would have to quarantine for 14 days following their last contact. And the definition that is widely used is within 6 feet of another individual for a period of 10 to 15 minutes, depending on exactly who you're talking to. And Madison County Department of Health has tended to be using a 10-minute definition for that. In that definition of a close contact, though, they take into account things like proximity, how close you are with another person, whether or not you're making physical contact with that person. And they're also thinking about what type of activity you are doing when you are making that contact. And so they have actually gone to a 12-foot distance for close contacts for people that are doing physical exertion, running, or other athletic activities. And so given those parameters for defining close contact, it's really hard for me to envision soccer being played in a way that would not basically mean that the entire team would be labeled as close contacts. And therefore, if one of the members of the team tests positive, then the rest of the team would have to quarantine for 14 days. And obviously that then impacts their ability to be in person in school, and then also puts at risk family members that they might be going back to as well. So I think that the other sports that were labeled as low risk, I can find easy ways to mitigate that. I think cross country, even if you do have a 12-foot designation for close contacts, you can do things like stagger the start of when people are running, make sure that they are not run. There's not a mass start at the beginning, even if they're passing each other on the course. There's probably they wouldn't be within that close contact range for that long. And tennis, I think, is another sport that was in that list that there's really low risk of being labeled as close contacts. I don't see that soccer fits into that parameter. And so that's really my main concern with the return to athletics plan. I guess the other part of that is that this is all predicated in a situation where we're not actually doing testing. So we're reliant on symptomatic individuals to be diagnosed for COVID-19. And we know that there's a lot of asymptomatic spread, especially in young adults and in children. And that also has me concerned in that you could be spreading it among a team fairly rapidly without having a real efficient way of monitoring that until someone has symptoms. And by then it's probably too late. You've already spread it pretty widely. The third concern that I have is just with our section, and that our section spans such a wide geographic area. It seems really unwise to me to be having teams travel as far as Old Forge when there are differing rates of infection across the region. And I would be much more comfortable having students competing against more local schools rather than spending potentially hours on a bus to get to and from areas where they're going to be close contact with people from very differing areas with very different rates of infection. And again, I think we're lucky here in Central New York in that largely the rates of infection are fairly low. But that does not necessarily hold for a month from now, and so on and so forth. And so I think that my concerns really kind of stem from those ideas. Again, I'm all for sports. I think sports are a really valuable source for our students, and my kids are aching to get back out on the soccer field. But I think that at this point, especially given that it is so soon past the start of when students are back in school, it's so close to the start that we really just don't have a sense of exactly what's going on in our community with the schools opening. And so that's, I guess, another concern that I have. So I will stop there, and I'm happy to take any questions if you have them. Otherwise, I will turn it over to my other expert colleagues on the panel.
Thank you very much. If Dawn, if you could introduce yourself and let us know your professional background, and then go from there, and then we'll move on from there.
Sure, I'm happy to. So I'm Dawn LaFrance. I work up at Colgate. I'm the director of the Counseling Center. I also have a private practice, so I'm a clinical psychologist. I'm also a parent of two Hamilton Central schoolers. But I am in favor of returning to sports. I appreciate Jeff's comments. I think that we can think creatively about how to manage a soccer field. I think that we can use a lot of different strategies to help us with that close contact, which is certainly a concern. I think that we can think about busing in a different way. I know that parents that are involved in sports are very interested in carpooling. We can use camp chairs instead of benches. When students are outside, I think there's also some different parameters, and I'm going to ask Heather to speak about those versus inside with the 12-foot rule. So I think that, the sports that have been qualified as low to moderate sports actually could be safe for our children. And I do care about the safety and health of our children. But part of the safety and health that I really care about is their mental health. And I know that there's a lot of children who are struggling a lot. I think it's important to realize that we don't know the long-term consequences yet of our youth who aren't able to perform some of the activities that they really love. I think that we're looking at data, but we don't have all that data yet. So there's a lot of mental health concerns for teens. I think both in this district and outside of this district. I think that students lose their motivation if they don't have their sport. I think that they might go on an unhealthy track. And they also, many of them look up through their coaches who they're not able to work with at this time. I know some other districts have allowed their coaches to stay involved with their student athletes, but we have not done that. And I think that our students are starting to look at other trainers and other coaches because they love their sport and they're still going to do it. So this brings me to sort of the point about pay to play. A lot of students in our district are very passionate about their sports. Some of them are hoping to play college sports. They're finding other ways of doing this at this point. So they're finding leagues and clubs outside of our district. And some of them, in fact, are going to be traveling to Pennsylvania and Connecticut. I think the more that we decide that we can't do it here, the more that people will find other ways to do it because it's so important to them. I think that we can look at where the students travel to. So like Jeff said, maybe they don't go up to Old Forge. But we have a lot of neighboring districts that we don't play all the time. So maybe we look at, revising that for this year. We're already revising the competition schedules anyway. So do we look at which schools decide to have fall sports and then revise the schedule? Maybe it's not as based on what size of your school for this term, but it's really based on getting some competition and the kids back to what they love with the coaches who they really love to do it with. I think we have an excellent coaching staff. I think we have a really smart administration. I think we can think creatively about how to do this. I think the coaches can help with all the health and safety regulations because they have the respect of the students. But I know that other leagues and clubs are already doing this. So I think that we can do it too. And I think that if we don't do it, students will find other places to do it. And then I actually think that our risk can increase because they'll be going other places to play and then they'll come back home again. So I just think it's important to have that in our consideration. I think that some of our students are going to suffer without sports, and I think that this is something we can do to mitigate that. It's going to take some work. It's going to take some creativity, but I think that we can do that with the right kind of PPE, the right kind of health standards and having coaches that are out there helping to regulate the distance and the close contacts as appropriate in different places. So I just wanted to put those points out there. I appreciate the time that you're giving me to talk about this, but I do feel really strongly about this. I know that there's a lot of districts who have decided not to do sports, but there's several that are moving forward. And I think that we can find good competition. And like I said, if the students don't find it here, they'll find it other places. A lot of them want to continue to do this. Thanks.
Thank you, Dawn. Dr. Myers, I believe you're on. Dr. Myers?
Are you able to hear me?
Yes.
Okay, sorry. I think I was unmuting myself to the viewer, and I apologize. I am a technophobe. So I'm a pediatrician in Hamilton. I'm also on the Madison County Board of Health, and I think that's why I was asked to be part of this. I also have 3 kids in the district that are unfortunately spaced, so that I have a high schooler, a middle schooler, and an elementary kid. So my kids are in all different areas of the school. I think that I probably fall somewhere between Jeff and Dawn. It's rare that I find myself disagreeing with Dr. LaFrance. I think my biggest concern here is that the school has done so much to make opening the school successful. They have worked so hard to put policies into place so that kids can get back to school. And to Dr. LaFrance's point, I think there are so many kids who have suffered with their emotional health. And this virus has hit kids in their emotional needs and their social needs much more than it's hit them in their physical needs. We've been, the fact that we have closed schools has actually kept both kids and adults safe in terms of health. But we've had more kids die of suicide by far than we've had kids die of COVID. On the other hand, we've just opened school. So my biggest concern about going back to interscholastic competition right now is that those kids who most need to be in school, if we start competing against other schools, then we are cross-contaminating different districts. We may have to close the schools. The way that the reopening plan reads to me is that a few cases in HCS would lead to at least temporarily closing. And I worry that after less than 2 weeks in to the start of school, starting to have kids interact with kids in other districts, to me is problematic. I think we were lucky enough to start school at a time when Madison County has extremely low case rates, which is exactly when you want to restart school. But I think part of why New York State has been successful in driving the rates down is that we've opened things on a stepwise process. And after each reopening, we've waited a few weeks so that you can have a few cycles of transmission before we make that next step to reopen. Unfortunately, the distance between the late start date and the first frost is so short this year, so it's kind of forcing our hands. But it does make me, I would love to see kids get back to practice and conditioning and working with their own teams sooner rather than later. And I think that would at least fulfill some of what Dr. LaFrance is talking about in terms of providing the getting back with the coaches, getting the physical activity that we need, being back as a team. But I'm worried that waiting less than a few weeks after the start of school to bring kids to other districts, even if they're close districts, it just increases. If you look at the number of kids who've had to be already sent home, tested, and that contact tracing that comes with that, if you're sending an entire team home, and then potentially every person in all of their classes, I find it hard to figure out how that's going to work. So I'd love to see them open for practice and for conditioning. But with the short season this year, I can't see a way that it's terribly safe to do interscholastic competition.
Thank you, Dr. Myers.
Thanks.
That brings us to Heather. Heather, thanks for spending your birthday with us. If you could, please let us know your professional background and go from there.
Yes. First of all, can you hear me?
Yes.
Okay. All right. So thank you very much for giving me this opportunity. My name is Heather Bernard, and I am also an HCS parent of 2 high schoolers. My background is in infection prevention, mostly related to healthcare. I have been an infection preventionist for 17 years. Most of my time has been spent in the Utica hospitals. I was most recently the director of infection prevention and acquired my doctorate in nursing practice with a focus in infection prevention and environmental safety. So I have a lot of experience in discerning guidelines and really implementing guidelines that are put forth by regulatory agencies, most of which are extremely difficult to do, but in a realistic way. When you're reading the guidance, it's very difficult to. It's really easy just to think that it looks really simple to implement, but in the reality, it's not. So that's pretty much my expertise. I can take those guidelines and implement them into realistic practice. I have been immersed in COVID for the last 6 months. I most recently left my position and working for the CDC Foundation at the New York State Department of Health. I'm not representing the CDC or New York State Department of Health here. I'm simply explaining my experience and my background, and I'm extremely passionate about this. I have seen the deaths. I have seen the serious illness that occurs with COVID, and I have also seen successful implementation of guidance that can keep the population safe. I had really taken an enormous amount of time over the last 2 weeks reviewing all the athletic guidance that has come forth from all of the New York State Department of Health, the CDC, New York State Ed, and the Association for High School Sports. Luckily, all that guidance is pretty much matches, which normally it does not. You have to kind of discern which to cherry pick from. I was able to read Lauren's plan, which is very comprehensive and does definitely cover all of the high level basics that would need to be into a return to play plan. I think after reviewing those guidelines, these guidelines can be managed. I think it's incredibly important for the mental health and well-being of these kids to get back on the field. I agree with the challenges that Dr. Myers discussed, but it's a little bit close to having opened up school. But we've also more recently, even just a month ago, opened up the colleges. And these were successful implementations and successful openings. And really, it was all based on guidance that was brought forth by many of the regulatory agencies. I think that the biggest hurdle will be during bench time. The kids are sitting close together. We can think of creative and alternative ways to make sure that they're not sitting close together. I think that engaging the captains and really getting them to understand what the guidance is going to be an important factor, because they will be able to discuss and reinforce those guidelines with their peers. They all want to be back on the field, and I think they're willing to do whatever they can to do that. And if that means wearing a mask and staying 6 feet away, then they can do that. The contact tracing guidelines are 6 feet, 10 to 15 minutes, as Jeff had mentioned. But in soccer, those connections are very brief. Those close contacts are very brief. And it's important to note that the requirement is that people wear facial coverings during that play. They also, all of the guidance talks about appropriate ventilation, and for indoors, you open up the windows. They're going to be playing outdoors, so that ventilation is ideal for as opposed to being inside of a building. The 12-foot rule is really geared toward choir practices and band practices and gym classes in an indoor setting where there's not as good ventilation. All of the guidance that is related to athletics is all with 6 feet. I'm actually concerned that if we wait until the spring, the March timeframe, I don't believe that we're going to be in a different situation in March than we are today. And we'll be having the same conversation about what are we going to do about sports. I think that There are states around us who have much higher positivity rates that have opened up and are playing high school sports. I think that the guidance is manageable. I think we have the guidance. We can work in very creative ways to move forward and go ahead and let these kids play. We can have some checklists that we could take some of these plans and make sure that at every game, all of the elements within the checklist are followed and covered, and that everybody is in agreement with them. We can have visual cues on the fields. We can have flagging tape to guide people in the right direction so that they're walking in one direction versus, all congregating in one space. And communication with the regional programs, those people around us that Dr. LaFrance was talking about, making sure that we're all on the same page, following the same rules. I think that this is a very unpredictable time. But I also think that this could go on for a long time. And I do really feel very strongly that we should educate ourselves, be nimble, be flexible, but at the same time, learn how to live in the reality of the situation that we are finding ourselves in, or else we'll all be in quarantine until another year from now. And I think for the mental health and well-being, it's just extremely important. So thank you for your time.
Thank you, Heather. At this point, I do have one comment that has come in online. So I'm going to read that, and likely, Lauren, I'm going to have questions start with you, and you can defer from there to somebody else if you'd like help answering, if that's okay with you. Online, at what point do the benefits of school sports not outweigh the risks? Would parents sign a waiver for athletics in relation to COVID be a helpful solution? So I don't really know how I'm expecting you to answer that, but I had to read it.
I can answer that, Michelle. If the board decides to proceed with fall sports, and that's one of the protocols that we put in place for parents to sign a waiver, we can certainly do that.
Okay. Thank you. We don't have any other comments that have come in online. You're muted, Dawn. Sorry. I muted everybody after.
That's okay. Hey, I was wondering about the survey that went out yesterday and how many families completed that and then what the rate was on that.
That's, Lauren, is that part of the next portion, Bill? Are we doing that in part of the athletics discussion part, or is that still part of 2.1?
That can be part of, now. Lauren can answer that now.
All right. And then I have another question after that.
So I shut the survey down this afternoon at about 2:00 because it gave it 24 hours to fully go through once the message went across. And 224 families responded. And of that, give me 1 second to pull the numbers up. I'm sorry. The percentage was 79.5% in favor of sports starting on September 21st, which was 211, that was 178 votes. And then it was 21.5% in favor of postponing until January 1st. And there were some.
That survey went to everybody in the district, not just those that were actually participating in the sports, correct?
Yes. So it was posted initially on School Day, and then it was sent out in a mass email to all districts or all families in the district.
Okay. Thank you. The next question. Oh, sorry. Were you
there were just comments related to that a bit, but I can rate and give them.
Oh, yeah, you can do those, the common theme ones.
Okay. So some of the common themes in regard to starting sports on September 21st, where students are already participating outside of school, as Dawn mentioned. It impacts their mental and emotional health. It motivates students, and students are already losing motivation in school. Our region's at a low infection rate, and that our students need sports. The common comments against starting sports is that there's a hard time differentiating between the PE requirements versus the athletic requirements. They're uncomfortable with soccer being classified as low risk. Academics are priority. Let's see how our plan works before we jump into sports. Local ASO wasn't playing for safety purposes, or athletes could make the same sacrifice. And then opening up interscholastic sports could lead to risk of exposure for our whole district. So those were just some common themes. There were some more specific comments, but those were the ones that were most prevalent.
Great, thank you.
Michelle, can I follow up on that? Real quick?
Sure.
On that. It did seem, looking through, because you provided with us the full comments, it did seem like there were some people that were saying they wanted sports, but that didn't seem like their comment seemed to be also, they were worried about the interscholastic part. That seemed to come up. Was I reading that correctly?
I do think that there were some people who voted yes to start the sports, but then in the comment section were asking me questions, which, so their vote still counted as yes, but they still had questions. So some of them were asking, well, how do we do this safely? Is there a possibility of just doing intramurals? That was a lot of the questions that came up. I don't know the percentage of yes votes tied to comments like that. It's difficult for me to read out, but I could go back and look at it.
Thanks. No, I just want to make sure that I was lining those up all right. Thanks.
The next question comes in from online. If Colgate and other universities have felt that it's safest to cancel sports, given the same mental health concerns, what makes HCS any different? I guess it's less of a question and more of a statement. So I'm not going to pose that for an answer. The next one here is, if we open fall sports on September 21st, would all levels of sport teams be allowed to play? That is, modified JV also be included?
As of right now, our plan is if sports starts September 21st, it would be all levels. I would probably look to push modified just back a week just for figuring out how to get everything going in a short, it's Wednesday now, so trying to figure it all out by Monday. I might just push them a week just so we can see how varsity and JV work out, but the plan would be all levels.
Great, thank you. At this time, do we have other questions for the professionals we've asked to join us, board members?
I have some questions. Nobody else?
Nope, you're good at the moment. I'll let you know if there's another online one.
So if I understand, Dr. Myers seems to think that any return to sports would increase risk to the general population of the school. So this is not just a matter of letting parents make choices for their own children, but it's also a matter of making choices for children who aren't necessarily in the sports as well, right? Because especially if it's interscholastic, then we're starting to mix with different populations of students. Does anybody on the panel disagree with that or would push back on that? That this is going to, that opening sports would increase, at least to some degree, the risk to all students, even those who choose not to participate in sports, either because they weren't already or those who are worried about the risk.
Can I clarify quickly my comment too? And my concern is not even just the risk of our other students getting sick. My concern is that a positive case, once we get to a certain level, would require closure of school and cancellation of classes in a program that we've spent so much time trying to develop. So it was partly the illness factor, but a large part of it is jeopardy to the plan that has been put in place to keep the academics open.
So yeah, that's my question for the rest of you. Is there anyone who disagrees that there is that same risk, even if it's just a risk of closure, to the entire student population?
So I think I'm going to just pop in here and say that that is a risk, but it's also a risk in the general community. It's also a risk for the kids who are going out of the district. They're a district that already plays sports. And I think that it can be better controlled in the high school environment with the guidelines that I was suggesting, having a regional, having those teams that we end up playing, having a checklist that follows all of the guidance. The kids are going to have to wear masks. The kids are, even when they're on the field, they have to wear masks. They still have to maintain that 6 foot distance unless they're practicing and playing. And that's going to be the same outside of the district when they go to those other sports. So I would say it is a risk, but it's a risk we're already taking. And if we can control that risk by having appropriate guidance in place, then we can reduce that.
Thanks. And this is actually brings me to another question I was going to pose to you, Dr. Bernard. Just to be clear, so you would envision a soccer game where all participants were wearing masks, whether they were on the field or off the field the entire time. Is that correct?
Yes. So, and that is the guidance, the latest, the guidance that came out from September 11th. So it's appropriate facial coverings. They define that the same way that they do within the school. And one other thing, that was brought up earlier was proximate contact. And there are talking about proximate contacts within contact tracing. And what that means is that people who might be outside of that 6 foot distance, but within the same confines of a potentially positive case or a positive case, that is for indoors, not in outdoor settings where there is ventilation.
And then with that, and I don't know if this falls within your realm of expertise. My concern would be about compliance outside in other districts, because, as you know, unfortunately, the issue of wearing a mask has become, unfortunately, politicized to a degree, and it's become tribal. Do you know how compliance would work in other districts and how we could ensure that the compliance, especially because I think if the materials we have from the district athletics is masks are required unless intolerable, and I think that leaves up to some interpretation that is individual to a certain degree.
Corey, I can speak on that a little bit because I just had a CSC meeting today, and that was some of the language I was concerned with in our last board meeting, and throughout all of my AD meetings, I was concerned with what does it mean to be intolerable. The CSC actually had a vote today about a bunch of policies that we put in place so that there would be continuity across the board going to every single district. And one of the ones that came up with was masks. And I was really pushing for more clarification on what it means to be tolerable, because in my mind and the way that we speak, at least within our district, is that they'd wear masks the entire time. That was not the consensus I got from the league. I was hoping to change the verbiage of that, and we actually had a vote about how we would put in our policy about masks, and they voted to uphold the state language where masks are to be worn unless intolerable. And I was the only one who voted no. And in our conversations, I didn't feel good about the conversations. They were talking about one wearing gaiters. Oh, they can easily pull it up when they have to, not like they can pull it down to get a quick break. Some of the ADs were talking about wearing masks around their wrist so that they're showing that they have a mask and they could put it on as needed. It wasn't that a lot of the conversation was not, I'll pop it down for a second because I'm struggling to breathe. It was, I'll show that I have a mask present, but it didn't seem like they would have the same level of mask wearing that we would have. So I left that meeting slightly concerned.
I can add that I've had parents contact me from other districts saying that even though their policy looks like it reads similar to ours, they came to parent meetings that were actually held in person, and the principal proceeded to take off his mask, and then all the teachers took off their masks and all the parents took off their masks, because in theory they were 6 feet apart. But the message was not, you may take off your mask for a break if you need to. The message was, if you're 6 feet apart, you don't need the mask. And so even though the policies can be written in a way that we all agree, the interpretation is really important, as Lauren.
So Dr. Bernard, is that, sorry.
Go ahead, Corey.
No, go ahead.
Well, no, I want you to finish this thought because my question actually goes back a little bit. So finish this thought.
So I guess with that information, Dr. Bernard, does that change your assessment of these guidelines being as effective as you seem to present them as potentially being?
So if there are districts that are going to go against the guidance, then I would say that is extremely concerning. I mean, it's pretty clear in the guidance. An intolerable means that if you, to me, or even in the healthcare field, we are required in healthcare in a hospital to wear a mask all day long. In schools, you're required to wear a mask all day long. If it's intolerable, you're not able to take it off. But to me, there should be some sort of physician documentation of that. And, you know, there are loopholes in some of this guidance that are not as clear, and that's across the board, no matter what type of guidance you're looking at. But there are interpretive emails that you can send questions to, and we can clarify that through that particular email and see if they have anything to say about it. But to me, if a person of authority was at a game and saw that people weren't wearing masks, then they would not allow that district to continue to practice. So unfortunately, yeah, that's not what I was hoping that Lauren was going to say. You know, I was hoping that we could come together with the districts that we were going to play against and say, these are the guidance that we all agree upon. And when we come to your school, you follow our rules, we follow your rules, and they're all the same. And that's where I was speaking of having some sort of an agreeable checklist. But if that's not the case, then I am a very strong proponent in the masking. I am a very strong proponent in the social distancing. And I am extremely confident that that's the type of stuff that has really controlled our rate of positivity. So that's disturbing for me.
So my questions, Heather, one of them is just a circumstance that I have not seen the outcome of what contact tracing would be, but I have read about, and that is cumulative contact. So Madison County uses 10 minutes. So I don't even want to talk about 15 minutes because it doesn't matter. And I can give you 2 examples of where outdoor exercise, 12 feet was the rule that was used. So Madison County is using 12 feet even with outdoor exercise. I am aware of two issues of people being put into quarantine because of that. So then if we're talking 10 minutes, do you know what the county is using? Must it be 10 minutes all at once, or is it a minute, cumulative to 10 minutes?
No, so there is not a definition for that, but it is based upon the amount of physical contact that you have with somebody during the period of time. The proximate contact guidance is probably going to be somewhere within an hour once they do define it. And then that is purely up to those investigators who are doing the contact tracing investigation to discern how much contact they actually had and what kind of contact it was, whether or not it was within a close enclosed space, was there actual physical contact, things like that.
Okay. Does anybody know why New York State Department of Health, NCAA has soccer as a high risk sport. New York State Department of Health does not. Does anybody know what that difference is based on?
I think it's based on the NSHS guidelines, which classified soccer in the low to moderate risk. I think they just took the guidance from the National Federation of High School Sports and just kind of transplanted it into their plan. They didn't look at the college level. The initial guidance that came out was from NSHS.
Okay.
And the State Athletic Association is starting to align themselves more commonly with the NFHS guidelines for sports.
Thank you.
So just, I want to make sure that we still get our time to talk. So I know, Travis, you had a question coming up, but I do want to make sure that we're considerate of time as well. So I think within the next 15 minutes, we should move on to the next portion of our meeting. So just to show a timeline on this for everybody. Obviously, if there's something burning, we can continue, but it would be great if we could continue to move on in the meeting. Travis?
Yeah, this question will go to Dr. Myers and Dr. LaFrance. So I understand the concerns over impact if fall sports are not to go on. I understand the concerns of impacts of the students' mental and emotional health. that the students need motivation and they're already losing motivation, and that our students need sports. I was taking that off of Lauren's kind of like bullet points. Could you both speak to if instead of fall sports, like we're talking about, if instead we went to some form of an intramural sports or sports conditioning, if either of you think that possibly going that route would in part alleviate some of those concerns?
Thanks for that. That's a really good question. I do think that they would alleviate some of those concerns. I think many athletes enjoy the competition, and that's actually what motivates them to work hard in practice. So you take away the competition, it's kind of like they're showing up and it's like a hamster in a wheel, like doing the same thing over and over again. But I think that it can help more than the state we're in now. So when I think about mental health, I also think about the importance of exercise and physical activity. A lot of our students didn't do very much this summer. I think if we were to find out the hours of screen time, it's probably increased dramatically even before school started again. And that concerns me a lot. I think that kids are sitting in front of screens a lot, and a lot have been playing pretty violent video games. I also know that a lot of students, when they lose motivation, they start to pick some pretty unhealthy habits. So I think that being able to go to a practice, have a coach who they respect, who is encouraging them to get better, helps with all of those things, including the exercise. So you could say, well, if kids need exercise, go tell them to run a mile each day. I don't know many in our district that will just do that because we're telling them it's healthy for them. But what I can tell you is that they would show up to work out with a trainer or somebody who they think really cares about them and their performance. The way we know if they're performing and succeeding is through competition. So I prefer that over doing training, but I would prefer training over nothing. So that's sort of how I would answer that. But I do think that physical activity, and there's plenty of articles to look at how physical activity really does help the mental health of our students. It also, I think that sports helps with structure and time management. So again, the long-term effects of this, we don't know because we're in it now. But I think that that's definitely going to hurt us. And before, when I was talking about the students who are able to play leagues and clubs, I think we're really differentiating on a socioeconomic status basis that concerns me. I think that some families are able to afford money, time, transportation to get their kids to places. Others can't. Some athletes are going to get better and some are not. And I think that that's a real thing we should consider in this district, because I think we already have some setup here with a sort of haves and have-nots, and I think it's just going to spread out more. And that's a mental health concern for me too.
Thank you. And Dr. Myers, if you're still...
I would endorse almost everything that Dr. LaFrance had said. To her last point, I was actually going to say something similar. I'd be actually curious whether there were more students who could participate if the travel for competition was not an issue. And then I know sometimes we've had to say no to our kids to travel teams purely because our schedules just don't allow it. And for kids who haven't ever played sports before, if there was an option for conditioning intramural teams, it may be that none of them would show up. But I'd be curious to see whether some of those quote have-nots end quote might participate a little bit more. I also worry a little bit to your point of kids who've been very sedentary for the last 6 months, jumping right back into conditioning or jumping right back into competition could potentially cause more injuries. That not only do we not have the requisite number of hours of practice before we compete the way that we normally require. I know that correct me if I'm wrong, Lauren, but it sounds like they have decrease that a little bit, but that's at a time when kids may have not done any sports in 6 months or any exercise in 6 months. I'll leave it.
I have questions online. I'm actually going to say them together because they kind of go together. How many districts in our league are participating in fall sports? And are there any sitting out? And likewise, are there towns sitting out, like area towns sitting out, for instance, Madison or Waterville, that might be competitors if we formed our own league per se?
So as of right now, the only ones that have confirmed that they're not playing in the fall one season is Cooperstown, Waterville, and Remsen. I believe I've gotten some messages from other ADs, but not confirmed by their boards yet. But I do know that the conversation was a lot of the leagues, districts still had to go to similar board meetings like this, and some were not sure how it would go as well. So we have 3 confirmed that are out. And I know that Bill has spoken to districts that are close in proximity to us, but not in our league, and some of those have opted out as well.
And Bill, other sections have opted out, correct?
Yes, Section 4 just opted out. Section 11, Section 6, maybe. So I think there's 4 or 5 sections now throughout the state that have said they would delay the fall sports season.
Okay, so that's what I was going to ask. So it's a delay to that March time is what you're talking about.
That's correct.
Okay. So Lauren, I had asked you a question about if we delayed until March, what could or could not students do at this point? I was, thinking about there are restrictions on preseason things and things like that. And you pretty much said that they would be able to train and practice and those sorts of things. We would have to create guidance and structure. How does this concept of intramurals fall into that? And how does the concept of perhaps playing scrimmages against another local Waterville or Madison or something like that affect that? Is that affected at all or not?
So just labeling any preseason activity as intramural now puts it into an extracurricular category, which would then have to follow NYSID guidance, which would put us with the PE guidance. So we actually don't want to label it as intramural, but if we label it as we normally do every year, there's open gyms throughout the year. I know basketball pretty much plays year round with Coach Blackford. So they have open gyms throughout the year that are open to all. It's not just open to the players on his roster during the winter season. It's open to all students within our building. If we were to take our Hamilton team and go play Madison, I think by this section, they would consider us playing interscholastic sports, and we would be not eligible to play in fall 2.
Okay. Thank you.
Again, just keeping an eye on time. Are there other questions that we need to cover during this period?
I'm sorry, Travis.
Michelle, if we have questions for Lauren, should we wait till the next portion, or as a board, questions as a board for Lauren? Should that be done now or later? Would you prefer?
Bill, thoughts?
I think we can, correct me if I'm wrong, Deb, I think we can meld 2.1 and 2.2 together. We're in a discussion about athletics. So
the discussions in 2.2, any questions would only come from board members. Is that what you're saying?
That would be
saying that. Oh, okay.
Yes.
Okay.
So I have a concern about moving things to March. I actually have several concerns about moving things to March. I feel like in some ways that's just us pushing things back and not really making a firm decision, because playing soccer and these other sports in March in upstate New York, I'm not really sure how we're going to get in the practices and the competitions. We've all lived through Marches here. So I just feel like that's kind of, it's sort of just pushing things back. And then I think, like Heather said before, we're going to be having the same conversation then, and there's going to be piles of snow on the ground, because we're not going to be at the point then, I don't see from watching countless news sources, that our students will be vaccinated by March. So I think that we'll be having the same conversation then if we were to say that we're delaying.
I have a comment and a question for Lauren. When in the AD meeting that you had, is this athletic directors from across the state, or is it for a certain region?
So this was just our CSE league. And the guidance basically says that we have to stay within our region, and the league was saying, well, we stay within the league playing each other. So that right now we have a just league schedule, and we're going to build on that. So we wanted to have policies in place. Well, so when we played each other, that we'd be having the same policies.
Well, I just wonder if there's some sort of a hybrid model that can be not called intramural, but can we have a memorandum of understanding with local schools like Madison and or Sherburne or Waterville, but I guess Waterville's not playing, but any of those other schools who still wish to play, but we stay within that group of people who we then have these guidelines that everybody has agreed upon. I just don't know the rules enough to, know whether or not that's possible, but I wanted to put it out there. So I do think that's important.
And just real quickly to Don's point too of delaying, kicking the can down the road. I think in some ways we all feel like closing the school, we're all back to where we started before. But I think that the point of flattening the curve was that we understood a little more about coronavirus. And so at the point we started to open things back up again, we at least had a better sense of how it was transmitted, how it was treated. I think there's a similar issue here that we've had kids not see each other for 6 straight months. And so the teaching early on was that, well, kids don't get coronavirus, kids don't spread coronavirus, kids under 10 really don't spread coronavirus, but we're learning more and more as things open up. They honestly do, they just haven't seen each other in a really long time. So the thing that it does do is it gives us time to figure out how do we do school right before we add the complicating factor. I really wish that we had turned everything on its head and before we opened the bars and the stadiums and everything else, that we had opened the elementary schools. But the timing didn't work itself out for that. And so that puts us in this position. And I'll shut up now and let everybody else talk.
Jeff?
I would just add one thing too, is that the thing that I think could change between now and March, and I totally get Dr. Francis' point that trying to play sports in upstate New York in March is not ideal. But I think the one thing that could change is our testing capacity. And I think that right now we're really flying blind, essentially in the schools, because we don't have testing in place until someone comes down with symptoms. And I think that the testing capacity, I think, is going to continue to improve. And I think we will be in a better place to be able to do more testing later on in the year. And so I think that is one thing that will change, even if we're not at a point where we have a vaccine by then.
And testing is going to have to be done outside of doctors' offices. That's something that we need to figure out how to do. So there's not really funding for schools to be providing the testing, but insurance companies don't cover testing if you don't have symptoms. So this is something that between public health and education and medicine, we all have to figure out together. But we certainly are happy to test anyone who has symptoms. We are happy to have anyone pay for a test, but we can't just give out the test for free, unfortunately. And I know the schools have not been given any of the funding to do the testing themselves.
Can I just go back to Heather's question? She was asking if it would be possible to play local districts unofficially, if you will. That goes against Section 3 rules. It would say that we're playing interscholastic sports, so that would void our any other season. That would be our season.
All right.
Lauren, can you just explain how our league encompasses geographically and the schools involved in our league? I think that would help put in context.
Yeah, so our league, like we have said, stems all the way from Old Forge to us in Morrisville to Canastota to West Canada Valley. So all of us are part of this league under Section 3. So the CCL has teams and districts, neighboring districts to one of our member districts, Sherburne. The CCL is right next to them. The CCL is likely, as of right now, I'm hearing that they're potentially voting no as well. So Sherburne had the same thing. Could I just play local schools that way? So we're spread very far out, and we understand that. But as a league, we would have to keep the same policies within ourselves.
So, and just to clarify.
Stockbridge. Oh, sorry, Corey. Madison and Stockbridge are in a separate county. They're in the CCL. So even though they're our neighbors, they compete in a different league governed by different rules.
So
Lauren?
just to be clear on that, Lauren, what you're saying is if we did have this kind of controlled interscholastic season, we could do that. It would just make it so that it would just mean that we couldn't have another season in March.
Yeah.
Okay.
Right.
And then
go ahead, Corey.
Sorry, this is just another follow-up on that. And first, I just want to don't want to miss a chance to thank all the panelists who are here. I think it shows one of the many privileges our school district has to have such ready access to so many experts, and this is fantastic. And I really appreciate all your time and also the participation of all the parents, not only for just their normal participation in sports and all that they put in, but to come to this and be concerned on behalf of your children. I appreciate that as well. But just one final follow-up on thinking about having some kind of a more controlled season, whether it be some form of inside of the school athletics or training or competition, or something more controlled with just a few districts that we find share our values on how these guidelines will be followed. I'm just wondering, Dr. Holm, if you think that would then moderate the risk to a much more acceptable level if we were to have that control, that level of control given back to us.
I do. Again, I think that as Dr. Meyer said, the risk of going outside of our general region is that we are kind of mixing the pot a lot more, and I think if we are a little bit more self-contained, I think that does mitigate some of the transmission risks. I still am concerned about who would be designated as close contacts, but I think that if those close contacts are within our district, that's a much different situation than having close contacts outside of the district, and so I think that does make a difference in our in the potential risk for needing to reclose the school or otherwise.
Thank you.
Okay. I have one last question from online, and then I think we should, in the interest of time, move to the next portion of the meeting. Is it correct that athletes will play up to 7 days per week together in a condensed season?
No. So they did not waive the 6-day or 7-day practice rule, meaning that they would still only be eligible to play 6 days a week until October 19th. So that first month, they'd only be able to get 6 practice or contests in. So looking at transportation purposes, if I had to put games on Saturday and Sunday, they would have to take a day off during the week. So they cannot play 7 days in a row until October 19th, when that 7-day waiver rule is eligible.
Thank you. Is everybody on the board good with us moving on to the next part?
Michelle, I do have a question for Lauren, just because we were on the topic. So, Lauren, you had stated, we couldn't play some of those other teams that are in CCL League. But since there's no sectionals or state championships or anything this year, would we be able to play those other schools as non-league games?
We could play them as non-league games, but we still have league commitments to fulfill. So we still have to play our league schedule, which I have the alignments in front of me. Our boys league schedule, the ones that are still in for boys varsity, Sequoia, Westmoreland, UAS, and Poland. For the girls that are still in are Poland and Oriskany. So we still have to fulfill those games, and then we could look outside. But as a league, we did decide that we wanted to try to stay in our league as much as possible to limit any extra exposure.
So is girls down to only 2 other schools to play anyway?
Yeah, so Remsen is in their league and they're out. I believe Old Forge is in their league, and I think they have a vote tonight. So I think that's why I said that they're not in there. But as of right now, Old Forge is in there. ODY is in their division, but they don't have a varsity team. And then Oriskany.
I am typing onto the chat right now, so sorry. I don't mean to be rude while I'm typing. I just want to let everybody know that we're going to close the community comments now and move to, but as we move to the next portion, for our professionals that joined us, again, as Corey stated, thank you very much. You are welcome to stay on with us. If you don't mind just muting, you're more than welcome to stay because you're already logged into the meeting, so it seems silly to ask you to log off and get onto the other portion of the meeting. So please feel free to stay on if you would like. But we do really appreciate the time that you spent with us and your thoughtful considerations for our students. So thank you very much. That moves us to the discussion for return to play. Bill, I'll let you kick off this section.
Sure. I would just like to reiterate and thank our professional panel. Your expertise, your care for our students, your vested interest in our district. As Corey said, the districts that have the resources that we have available to us, and your opinions tonight were well spoken, and we appreciate them. So thank you. Today's league meeting, I think, brought many concerns to light with the masking protocols or lack of consistency regarding what's considered tolerable and what other districts consider appropriate face covering, amongst our league schools. So, I think that's left all of us a bit uncomfortable. And I know that's not what we were looking for out of that meeting. We were looking for consistency amongst our league schools to put together some safe protocols that would protect our student athletes. Our student athletes need to be playing. We want them to play, but we need to do that in a safe manner. And I think that the league's lack of action today, I think, really left some concerns amongst all of us. Lauren, I don't know if there's anything you would like to add to that.
Yeah, I agree with what Bill was saying. I was very excited going to the meeting, and then when we started sitting down and voting on policies, it started off really well. And then we got to spectators, which was my first point of concern, because a lot of them started saying, well, you actually can't mandate anybody to take any COVID screening, and you can't mandate temperature checks, which that was part of my plan to make sure that we're mitigating outside individuals. And a lot of them were saying, well, they can't mandate surveys and just note anybody who didn't complete it. So that was my first red flag. And then when we got to the mask conversation, I just grew more and more frustrated, because it seemed like they all said that they were going to encourage mask wearing, but I think the underlying tone was each district can make their own decision. And when I said I was frustrated, the comment back was, well, Hamilton can choose how they want to wear masks, and they can choose if they want to participate. Not really as much concern with us. So I left the meeting feeling pretty discouraged, because I want our student athletes playing. I'm a PE teacher. You guys know that. I love moving. I played sports my whole life. I couldn't even imagine being in the situation these kids are in, not playing a sport. But I do think we need to think about the consistency across the league. And I think that it's also going to bring up some problems with spectators. If the athletes aren't being asked to wear masks throughout the game, are the spectators going to follow the same rules as well?
Lauren, can I ask you a quick question there? That comment you said that was made about, well, if Hamilton wants to, was that your interpretation, or did somebody in the meeting actually say that?
No, somebody said it. He said Hamilton has the choice to choose to play in the league or not. I did say that I was going into a board meeting tonight and we were going to be discussing it, but that's what the comment was.
Okay, thank you.
Go ahead, Ellen.
Sorry, I was going to say, can I ask a clarifying question on that about whether or not you can mandate screening? Because it was actually one of my frustrations reading the guidance. And if I understand it correctly, the New York State Department of Health guidance regarding sports and recreation says that you cannot mandate temperature screens and all of that. But the New York State Department of Health guidance for schools says that you are required to mandate screening or can mandate, I forget exactly, but you can mandate screening of students and visitors to the school. So that, to me, was one of those places where there was this conflict. And I feel like, so do you get to choose which of one of those you follow? Do you follow the school one, or do you follow the sports and recreation one? And I think, again, that's a setup for having different answers. Is there any clarity on that anywhere, or not really?
No, and again, like you said, I think the schools will pick and choose what they want to do. I think that all of us, we do have a common COVID screening in place, but are there chaperones going to say, no, you cannot come in here because you did not fill that out, or you won't take a temperature check? No, I don't know what that will be across the board. We did vote on temperature checks, and only 3 districts, myself included, voted to mandate temperature checks at games. So it was voted down 20-3. So they're at our neighboring districts, you could choose to do it, but a lot are saying they will not be doing temperature checks at games.
My question goes to some comments that we were talking about before about if we decide to delay and play in fall 2, I think is what it's been called. How do we therefore make it okay to do practices in-house for, getting students back moving and working with their coaches and working on their sport? Bill, how does that look, and what shape does that take after this?
Yeah, if the decision is made to delay, I feel really strongly that we need to provide some sort of participation for our athletes and bring our coaches in, allow them to work with our kids. We'll work with Lauren to put into some safety protocols that are consistent amongst all of our coaches. We can still do temperature checking, screening with our students, that are on virtual days that come in for practice. And I really feel we have to provide those opportunities for our kids, for the many reasons that our professionals talked about tonight. Our kids need it, and our coaches can do a wonderful job leading them in a very, very safe manner and give them, sorry, my lights are flashing again, to give them the opportunity to compete. So, we can work with Lauren, we can work with our coaches to put some protocols in place to be able to provide those opportunities for our kids.
Thank you, Bill.
Can I ask some questions that haven't been asked? Is now the time? We've talked a lot about soccer. Cross country, it sounds to me like if we can't come to standardized protocols on masking and screening and all of that sort of stuff, that's going to be the same concern. We don't play tennis this time of year, correct? We never have. But the two other sports that stand out that I think haven't really been touched or discussed is field hockey, where we traditionally have had a handful of students play at Morrisville, and swimming, which I don't know if we swim in the fall or the winter, or if there's a difference. What are the situations with those sports?
So we don't have any students signed up to play field hockey with Morrisville, so we don't have a combination contract going with them. And then we are combined with Sherburne, Earl Hill, with their boys swim team. We have one. The fall is for girls swim, and we only at this point have had 1 or 2 girls interest and have swam in previous years and have had a handful of boys who've swam. So we have a combined contract with Sherburne for the winter.
So that's boys winter, girls fall. Is that what you're saying for swimming? Okay. Yeah. So if we make decisions about what we're deciding, does it need to be a blanket decision about all fall sports, or can we pick and choose decisions about individual sports? And do we know what Sherburne-Oldville is doing about swimming? Obviously, you're not wearing masks in pools and things like that. But
I will tell you that Sherburne has expressed concerns over finances. And when we discussed CSE dues today, he said he didn't even know if their business office would put in purchase order to pay for the dues. That's where their finances are at this point. So I do not know they haven't said no to fall sports yet. But I'm not sure what they're going to do with winter sports. And then I do think that we could have cross country go now and then push soccer, but I think there's a lot of logistics there that we'd have to consider as well. But I do know that when I did poll the coaches, that was the cross country coaches were concerned with coming back to coach, and they also said that there's a lot of invitationals. All the invitationals have actually been canceled, and they were saying that the pool is very low at this point of who they would play. So they'd actually prefer to move to the spring and try to get more competition.
Okay. Thank you.
Lauren, I have a question for you, and Bill and Mark, perhaps you'll want to jump in if you were involved in this. For context, Who was this survey sent to and when? I know you touched on it earlier, but the athletic reopening survey.
Yep. So the survey was sent at first just posted to Schoology, and then Chris sent it out virtually to all, I believe, all families or all emails. Maybe Chris can speak on that. He sent out a mass email out to everybody, so everybody within the district had access to it.
So my follow-up to that is the people that it was sent to, obviously their opinions are definitely helpful and wanted, but is it fair not to seek the opinions of district residents as well? Meaning like retirees, those who don't have students enrolled, taxpayers in general, because we're not just talking about the health and risk for students and staff, but also our general community. Would you agree that their input would be helpful?
I do agree that their input would be helpful. For the sake of time, it was difficult to even get the survey out to us.
I understand that, but for me to take that information, I'm looking at one portion of it. I kind of needed more than that, but I totally understand that that wasn't feasible with the time constraints. But I just wanted to clarify who it was sent to.
And Lauren, just as a note, Sherburne has their meeting tomorrow, and they're going to decide on fall sports tomorrow. They're going to discuss COVID and budget at that time.
I don't really have a question, but I have a comment that I just keep going back to. And it's just, Lauren, hearing your comments has made me, this was a concern coming into this meeting tonight, and hearing your comments about what some of the other leagues have said, it leaves me a little more concerned to go back to several of our kids at all levels are playing on these travel teams. And I think it was stated earlier, I know a group of our students are traveling to Pennsylvania very soon. That's on a mixed group. I see several kids, at Eaton Street Ball Field almost every day that are mixing with other school districts. I see a lot of our kids playing on leagues at Accelerate that are mixed with a lot of these other schools that are both combined teams and, just teams that, for the sake of naming, I guess, are Hamilton teams. So I guess I'm trying to wrap my head around the fact that, and again, I think this was stated too earlier, do you think that we could have more control, and do you think there would be as many kids participating in these other outside leagues if we did bring these sports back to our home district where we could have control of it? Like I said, I know the leagues for a fact at Accelerate, they're not wearing any masks. And I've seen several pictures and photographs of our kids that are coming to school every day with other students not wearing masks. So I don't know. I'm having a really hard time wrapping my head around that. And do we think that any of that could be decreased by bringing the sports back to our school?
I think these kids are going to still play on those teams. I mean, I think they played on those teams before, and they're going to play on them now. They're going to also play on the Hamilton team. So that's just my take, is that I don't think we can or want to control. We can't think about that piece, because we can only think about the things, excuse my dog barking in the back, for the things that we can control. And the things that we can control aren't even things we can control, from what Lauren's saying, with these other teams following the rules that we hope to do. So I get where you're coming from on that, but I don't think that that's going to change whether we have sports in Hamilton this season or not. That's just my opinion.
Michelle and Jennifer, to that point, because I wanted to bring that up, like Michelle said, they're going to do it anyway, in my opinion, but we have no control over that. We have no right to tell them they can't do that. But what we do have is a liability for our students and what we sanction as a district. So if those students get sick or whatever in a traveling sports league, we're not responsible for that liability. But if something happens because we opened up sports and didn't have the right protocols, what have you, we can only concern ourselves with the liability that HCS holds for those students.
I do know, if I can jump in for a second, I do know that some of these outside leagues and like AAU and ASA softball travel teams, once those athletes join a varsity team, they no longer allow them to play on their travel teams. I don't know if that's consistent across the board. I do know that in my experience that a lot of those leagues do not allow their kids to play once they're on a varsity team. The varsity team takes priority.
Thank you.
I've heard that as well. And I've also, and the only reason why I mention it is I've heard from several families of, since Hamilton doesn't have this, we've gotten our kids involved in this because they need sports and we need to get them active. So I'm just wondering what we can do to kind of bring them back here where we have some control.
And I feel like if we're bringing them back and we're doing practices and training and working them out with their coaches here, although it's not competition, that we are doing what we can to do it that way.
And I would just add to that, at least in my mind, it feels like we have a great administrative team here with an athletic director who is a PE teacher. We've got a superintendent who's a former athletic director and a PE teacher. We've got Mark. So between the three of you, I can't see a better team to put together that can do something, whether or not it means interscholastic sports or some other alternative where students are still training. They would be competitive and fun and be an outlet for our students. So am I right in saying that whatever we decide, we can still provide some level of athletic training and opportunities for our kids that can be fun and competitive and provide them the mental health aspect that they need? Also, I think about Raider ball. We don't need to go to another school to find competition, right?
I think we absolutely owe that to them, Corey. If the decision is to delay, we have to do something creatively to involve our kids athletically and come up with some creative, safe mechanisms for them to be able to participate and have some sort of athletic experience.
Lauren, at the last meeting, I asked you a question. In the policy for reopening athletics, if a coach has to be quarantined or what have you, who would take over for them and the impacts that would have? And now that you've had some time to think about that, what would be the scenario if that were to play out?
So I did have some time to think about it, and there have been instances in which coaches have been sick. Like for myself, and I remember I had the flu during a volleyball season once, and the JV coach did coach for me. There have been other instances in which coaches have had family emergencies and they're unable to coach for an extended period of time. And so I think we do have a really strong coaching community that we'd all be willing to help each other. I coached modified soccer last year, and I'm not a soccer person. So I know that we're all willing to step up and do what's right for the kids and be there for them. So in the event that somebody did have to be quarantined, we do have a really, I know the cross country coaches work very closely together. The soccer coaches, I've been in constant contact with all of them, from the modified all the way to the varsity boys and girls, who have a group message going, talking about sports at all times. So we do have a good community of coaches that are also teachers that I think would be willing to step in and help.
Okay, thank you. And this question is for Bill and Mark, I guess. What were the reasons for, not the athletic plan, but the reopening of school plan? What were the reasons for separating the middle and high school students?
You want to take that, Mark, or you want me to go?
Sure. The biggest reason was the size of the district. We couldn't house both middle school and high school in the physical space together.
And correct me if I'm wrong, but I'm pretty sure I remembered another reason was that we felt it was important to help keep the two groups of students away from each other to help mitigate a possible exposure. Is that correct?
Yeah, and when it came down to tracing, if we had 6, 7, 8 compared to to 6 through 12, it would be an easier process in that, and you'd be separating those cohorts. Yes.
Okay. Thanks for that clarification. Now, Lauren, under the plan as it is right now, would modified athletes be on a JV or varsity team?
The way their plan reads right now, we would allow for APP, which is the athletic placement process, to push students up. And there are a handful of 8th grade students that were asked to play at a higher level. That was a conversation I wanted to have with the board as well, to see if that was something we wanted to continue with, because I know you brought up a lot of concerns about commingling the middle and high school. So I wasn't sure if that was something that we would allow as a district.
Yeah. Well, it's hard for me as a board member to tell, our students that they can't be in school. And Mark, I understand that part of this has to do with room and staffing, but we can't pick and choose when to apply reasons and rules. And I totally understand, and I feel for the students that this might affect, but I do have concerns with mixing middle school students in with their JV and their high school counterparts, because as stated in the reopening plan for academics, there was a concern that they should not be together. I understand they're going to be together outside of school. That's fine. We don't have control over that, but we do have control under things that happen under our rules. And it's a concern I have, and I wanted to see where we stood with that.
If I can add on to that, I think that for me, my question would be, obviously anything we do, whether it's going back to school or, whatever we do, has some level of risk we're adding. And so I'm wondering if this increase, what is the level of risk we're adding by allowing middle schoolers to mingle with high schoolers? And is it significant to the degree that we should be worried about it? Or is it something that in the grand scheme of things is pretty low, considering how many of them may already be mixing? I know I have a middle schooler and a high schooler at home, right? So they're already mixing that way. They're already kind of cross-contaminating. And I imagine a lot of people who have high schoolers also have middle schoolers. Most people have kids close in age. So there's probably a large level there. And I think that we might be able to see, just from what we know about who's in what family, if a couple more students is going to add, or even are those students already commingling at home, and so it's not as much. That's just, and I don't know who answers that. If Ellen maybe has some thoughts on that.
Well, it was actually something I needed to think out loud. Dr. Myers knows I need to think things out loud often, but this was one of the things I needed to think out loud. And originally I was thinking about, again, something like soccer, where you've got 12 high school kids, 1 middle school kid playing with the high school players. If somebody on that high school team, it's actually really, if that middle school kid gets sick, you've now wiped out the high school team with quarantine and every class that middle school student is in with quarantine. Is that right?
And every high school class.
Well, no, because if a high school student, if a high school student gets sick, the whole team quarantines. So that 1 middle schooler quarantines and the high school class is quarantined. If the middle school kid is playing with all middle school kids, the middle school team quarantines, and the classes that kid is in quarantine. When you have that mix, if that sort of smaller group crossover gets sick, you're hitting 2 groups of students with quarantine. I needed to think that out loud. Does that make sense? Is that a concern, or is that like the probability of that is so low that we shouldn't make decisions based on that? That was
I don't
something
think that probability is that low. I think you're right in that they would be the 2 groups, and I also don't think that that's low. So.
Again, I was originally thinking of that with whole teams. Now, I think one of the creative options, if we start to talk about creative options, is smaller pods. And if you've got smaller pods of kids playing against smaller pods of kids, if you're playing 5-on-5 in something or something like that, I think the impact of that is then minimized because you're minimizing the number of people involved in the crossover. And so again, that may be a way to serve both needs a little bit. But I needed to think through that other point and know that it was making sense and not.
So it is 8:00, and I'm not trying to rush us, but at the same time, I'm also not trying to belabor the point of we need to get to the recommended action. Are you guys okay with getting to the recommended action at this point? Or do we need to spend more time discussing? Travis, you're muted.
Sorry, I just have one last question for Bill.
Okay.
Bill, this is just a clarifying question, but are we still hurting for substitute bus drivers, janitorial staff, and substitute teachers?
We're covered now. We're always looking for more, though. We could use help.
Okay.
All right. So with that, since it seems like I got a nod from everybody that it's time to kind of move along, I need a motion to consider the adoption of the resolution for athletes to return to play for the fall athletic season and follow the protocol set in place by the district as recommended by Section 3, the athletic director and the superintendent.
I'd like to move.
I'll second with discussion.
Okay. Discussion. I thought we just had discussion, but discussion?
Well, let's see. I'll be voting no, and I understand that will be disappointing to many people. I put much thought and time into my decision. I was going to go over some more reasons, but I'm fine. Sorry.
No, it's okay.
No, and I guess the discussion I wanted to have specifically after the motion is about whether or not we reword the motion, or do I propose a new motion or something along those lines. And one of the things that I want to say that I haven't said tonight is that, Lauren, any decision we make tonight has nothing to do with the plan you wrote. The plan you wrote was as good as it could have been. And so whatever happens tonight, I don't want you to feel like any of this is a vote of no confidence for you or anything like that. None of this is about any of that. I think the conversation has happened. And so I'm trying to look at the wording and trying to say what I would, and I don't know how to do this right. So what I would propose as a second motion is to, I would make a motion to defer fall sports to fall 2 with an active plan for open gym that allows our students and athletes to train and have some level of competition in the fall. So I don't know how to do that is what I'm trying to say.
And what I need to put in there is this motion was written by lawyers. So we need to use this motion because this is what Debbie has brought to us as the advisement of our council in that sense.
Can I clarify this motion that we're voting on? What the acceptance or rejection of this motion simply has to do with whether or not we'll participate in the Section 3 athletics, interscholastic athletics, as outlined by their plan, which includes concerns, which we all raised concerns that Lauren had included about the way that those policies will be enforced and enacted. Is that correct?
Correct.
That's what the motion covers. And the rejection of this motion would not mean a rejection of any kind of athletic sports at all. The district would still be free to find some other ways to engage in sports, just not through the Section 3 plan that they put in place.
It could not be interscholastic sports.
At least not through the Section 3.
But it was only C.
Or you would need other approval to engage in interscholastic.
Yeah, because we're governed by Section 3. Any interscholastic competition would have to be governed by Section 3.
So I guess to put it out on the table, and again, I just don't know how to do this properly in the form of motions and accepting or rejecting or all of that is so. Again, I think, my feeling about it at this point is that we should not move forward with the plan that's in place. And so then the question becomes, how do we then propose the substitute? And I think we've got any of 1,000 options that include choosing to create our own league this fall, which would then eliminate our ability to play in fall 2, correct? But does that put us into any other sort of violation, or does it just mean that we have played our season and that's it?
It's my understanding that any interscholastic competition in the fall needs to be played under the umbrella of Section 3 athletics.
Okay, so we can't, it's not just that it would obliterate our ability to have another season. We can't do it. Okay. So that was, I needed to clarify that.
But Bill, can you clarify if we rejected this motion, but then accepted to instate personnel for coaching, the district would have all the ability it needed to proceed with some kind of internal athletic training competition, whatever it is, as long as it's internal.
Correct.
So yeah, Alan, I think that eliminates your need for another motion. We vote on this motion on fall 1. Then we vote on the coaches for the personnel. And if there are coaches, then Lauren figures out what she needs to do with them.
Then there's something happening, and okay.
And if the administration can think of some way to engage in interscholastic sports this fall that would adhere to what we and the experts say would be the safe for our kids and for our community, then that could be brought to us at a later date. Is that correct?
I don't think that has to come to the board for approval. If we're in agreement that we want to provide some sort of interscholastic or intramural opportunity for our kids, we can do that at the district level.
Oh, but I'm saying if we were to say, figure out a way under the guidance of Section 3 where we could engage in interscholastic sports with districts where we felt they shared our common values on masking and other factors and other guidelines. And you could bring that to us at a later date and we could approve that if that were to be a possibility.
Yes.
Okay.
Do we... Go ahead, Bill.
You're going to add something, Debbie Curley?
I just wanted to, Travis, I know you seconded the motion, but then you said you're against it. I don't really think you can second it if you're against it.
Okay, so we need somebody to second it?
Yes.
Well, how do we move it to the point of being able to discuss it and vote on it if we can't?
If there's no second, then the motion doesn't, there's no vote.
When there's not even a vote.
So there's 5 of you. So if any other person on the board is for the motion, they can second it. Like Michelle, if you're for it, you can second it, even though you're the board president. Or if everybody's against it, I don't know. I don't know how that works. So,
I don't either, but I feel like
well, we can take Travis's and I can double check with my law book tomorrow to see how that works. Because I guess...
Well, we don't want it to not count as a vote after the fact. Like, we don't need to have another meeting tomorrow because we did something wrong.
Does it matter if I said I'd move it with discussion, which I did say?
Yeah, I don't think that matters, Travis. I guess I feel like the motion is for people that agree and want to resume or want to return to play. those feeling that they don't want to return to play probably should say nay when we go into the voting part of it. So I
don't know how motioning and seconding can affect that. I mean, I just don't want us to be wrong and have to not have this, whatever we decide tonight.
Right. So let's just, I'll leave it with Jen and Travis, and then we'll go to vote and go from there. And I honestly...
Because the motion is really just to put it to a vote.
Right, just to put it to a vote, right. So let's just do it that way. We'll leave it that way, and then I'll go from there.
Okay.
Can I ask one more question before we officially vote on this? Do we need to do anything to actively move to fall 2 if we choose not to participate now?
We would have to modify the section.
Okay.
Am I correct?
But that doesn't need to be part of the board vote or part of the...
No.
I don't think so.
Okay.
And I just want to make a comment just on public record that the safety of our kids in our district is that of my top priority. I certainly wouldn't be here if they weren't. However, I think that we also have a really great mental need. And I've firsthand seen several kids affected by this, even just in the past month of not having a preseason, and some kids really going down a path that I don't want to see our district in, obviously with a COVID outbreak, but I don't want to see our district with a drug or alcohol or a huge mental illness outbreak as well. And I just feel that athletics to a lot of our students are really the glue holding them together. And I truly believe that there's some of our students that are still engaged in school just because of sports. And I think that there's some kids that have just gotten by and, you know, that we've witnessed walk across that stage because of sports or their coaches. So I just wanted to say that out loud.
Thank you.
And can I just clarify with both Bill and Lauren? Sorry, somebody's calling my phone. It doesn't want to. It was my alma mater alumni office, so you'll appreciate that, Michelle. But I hung up on that.
Call him back, give him lots of money.
Can I just verify with Bill and Lauren, first, that you believe that no matter how we vote, we can provide students with a safer and fulfilling alternative to athletics? And second, that it seemed from your comments, especially Lauren, that you don't seem to be recommending that this would be, that following the Section 3 guidelines would be a safer alternative, and that you have some pretty serious concerns. And I don't know, if Bill, if you share those as well.
I do share those. I didn't until today, but with the discussion at the league meeting, with their lack of consistency regarding masking and their lack of consistency about safety protocols, I really have a concern with that.
I agree with what Bill said. I think prior to today's meeting, up until about 1:00, I was definitely wanting to proceed with fall sports, and was trying to find ways to convince you guys to do it. And then when I found out the same thing with the safety protocols, I think they're student athletes first, and their safety is our priority. And I want them to get back, and I think we definitely can find creative ways to get them active. It's not going to look the same, and they're going to have to understand that. Just like nothing's really looked the same this year, but just like all of our teachers have been committed to finding new ways to teach our students, I think our coaches would find new ways to teach our athletes.
Thanks. I really appreciate that. And Jen, I think that your concerns are a voice that echoes what a lot of parents are feeling and their concerns. And I hope that, and I feel like our administrative team understands that, and I hope they'll take that very seriously. That we do need whatever we do with our students to be robust and fulfilling as much as we can, even if it's a different way. And I do trust that you do have the ability and the desire to do that. And I hope that will help assuage some of the fears that a lot of us have that Jen has rightly pointed out.
And I do trust that. I guess my fear to that is I know that there's some students that would never, ever, ever miss a practice, but would very easily pick something else over an open gym. So I guess that's where my concern lies with that method.
Thank you, everybody. At this time, I think we'll move forward. The motion was to consider the adoption of the resolution for athletics to return to play for the fall season, and to follow the protocols set in place by the district as recommended by the Section 3 athletic director and superintendent. I just wanted to reread it since we've talked about it quite a bit. All of those in favor?
Aye.
All those opposed?
Nay.
Nay. I need a motion to take from the table from the September 10th meeting regarding personnel appointments for fall coaches. This is a motion to take from the table.
Second.
All those in favor to take this from the table?
Aye.
Aye.
Aye. I need a motion to approve the appointment of the following coaches contingent upon COVID-19 status, significant numbers of participants. I don't really like the way this motion is written. So, participants for competition and upon meeting the coaching certification requirements, first aid, etc., as mandated by New York State law, as recommended by the athletic director and superintendent. I don't know if I can, but I'd like to amend that motion after our discussions. Debbie, can I amend that motion, or does somebody else need to amend that motion?
You can amend it.
I'd like to amend that motion to have a motion to approve the appointment of the following fall coaches, to allow for, somebody help me with some wording.
Yeah, I think we need to be careful about this wording too, don't we?
Sport training.
I would say sport-specific training.
Sport-specific training for the fall.
And we still want them to complete the coaching certification requirements and
yes, as mandated by this. So I need a motion. I'd like to amend the motion to approve the appointment of the fall coaches for sport-specific training upon meeting the coaching certification requirements as mandated by New York State law, as recommended by the athletic director and superintendent. So I'm looking for a motion to approve my amendment.
Is the contingent upon COVID-19 part still a part of that?
I was not leaving that in there now.
because we're in school or we're not, right?
Well, I think last meeting, didn't we talk about that meeting? Was that the district COVID-19 status, or is that the coaches?
We may want to word it as following district COVID-19 policies and procedures.
I like that.
Yeah. Okay.
Debbie, do you get that?
I'm going to get it. I'll piece it together tomorrow. So
Okay. So I need a motion to amend this motion.
okay.
I'll move. I'll second.
Thank you. Now we have this new motion. Now we have the amended motion. So now I need a motion for the amended motion so that we can vote on it.
Do we?
I think so, right, Debbie?
Oh, you just amended it, so I think you can go ahead and vote.
Okay. Can I have one discussion point on it?
Yeah.
Yes. Can we discuss?
So, financially, if we have coaches coaching now and then potentially coaching again for a fall 2 season, how does that pan? I mean, because they're both going to be shortened seasons, right? So in the end, how does that pan out financially?
Go ahead, Lauren.
So the fall sport season 2 looks to be about 2 months. And then realistically, the amount of time that they'd be playing outside would be between 1 month to 1.5 months before really, like you guys said, the frost hits here. Mm-hmm. So it actually would equate to what would be our normal fall season, which is about 3 months.
Okay, perfect.
And Lauren, you had shared with us, and I don't know if this is something you want to make public or not, so please don't if you don't. You shared with us some concerns, some feelings the coaches had about the previous plan. If you feel confident, I don't know if they said it to you in confidence and it wasn't something that we wanted to put publicly. Do you think that having, as we discussed, some kind of alternative would assuage any fears or concerns that the coaches have about coaching?
I think that it would definitely answer some of the questions. I know that one of the biggest concerns with some of the coaches was how do we let our kids at 3 o'clock participate in a different way than we have them participate throughout the day in PE. So we'd really have to look at that. But I think that all of them would want to be back to training. I think a lot of the pieces where they're uncomfortable were playing other schools. And then also just the uncertainty that some of them didn't want to start seasons and have to stop halfway through due to outbreaks. So I think this might help as well.
Thanks.
My question is, if we approve all these coaches with the understanding of what we're looking for is like open gym or what have you, I don't want to pick a sport for a hypothetical, but if there is no interest for one of these coaches' sports, where does that leave us? Is that coach still on the payroll for this, or how would that work?
No, it would be very similar to, our sports seasons. We always make the appointment contingent upon numbers. So if there was no interest for an individual sport to do open gyms, then obviously you wouldn't pay the coach to supervise.
Okay, so it's not necessarily binding.
No.
Thank you.
All those in favor for the amended motion?
Aye.
Aye. Aye.
Aye.
I need a motion to adjourn this meeting.
Move.
Well, everybody can't move. Somebody has to second.
I don't dare.
Lauren, again, thank you. Again to those professionals that we had joined today. Thank you
very much.
Yes,
thank you for all the time that everybody's put in. Bill and Mark, thank you. We really do appreciate it. And to the students that are watching, we look forward to seeing you get out there and train. And your safety is our number one concern. And we hope you understand that. All those in favor of adjourning this meeting? Aye.
Aye. And well put, Michelle.
All right. Have a good night, everyone.
Good night.
Goodbye.